Vein disease is a very common problem, and treatment options are now better than ever, but a lot of people are still reluctant to get help.
Dr. James Garidi is here from Vein Clinics of America to help you understand the cause of vein disease and discuss some of the different options for treatment. You were just saying during the commercial break that you've seen patients even in their 20s who do what I consider to be the old-fashioned barbaric stripping method.
Yeah, it's really shocking, but I periodically will see people of all ages, including younger ages, who have just recently had a stripping procedure, which it boggles my mind it still happens.
Yes.
Yeah, I just had a conversation with someone the other day who was saying, oh, I need to have this vein stripped. I was like, you know, they don't really do that anymore. There's a lot of other ways to do it that are less invasive and way less painful. But people, you know, they know when they've got a vein problem. They know when they've got one that hurts or is a problem or unsightly, whatever it may be. What is vein disease, though, under the look of it?
Sure, and one of the challenges with that concept is you can't always see the vein. So sometimes it is under the surface. You're feeling a little pain over the inside of your thigh or the inside of your knee, or maybe the outside, and you think, oh, I have a knee issue, because lots of people have knee issues. And it turns out that when you look with ultrasound, sure enough, there's this vein that's under there. It hasn't quite bulged through the skin yet, but it isn't working right. It's under pressure, and it's causing pain. And so that's one of the other scenarios is we will run folks who have symptoms but don't have any visible outside of the body kinds of vein issues.
Is it quite common?
Vein disease? It's amazingly common. Most of the demographic studies are going to suggest as much as 25% of the U.S. population has vein disease. Some ethnicities probably have a little bit more vein disease. Probably Northern Europeans have a little bit more. Africans probably have a little bit less. But in the U.S., it's probably about 25%.
So is it genetic as well as demographic?
The vast majority probably is genetic, and the essence is all veins have some elastic in the vein wall. If the elastic isn't built right, you put that vein under pressure and it stretches abnormally. So you take, again, a person who has a tendency towards vein disease, that person, let's say that lady gets pregnant, which puts a lot of pressure on a vein, all of a sudden it'll just stretch out. And then when you're not pregnant anymore, it'll look like it deflates. And I always tell folks, it's kind of like that balloon. When you blow it up the first time, it's really hard to blow up. When you deflate it, it doesn't go back to normal. It goes back to a slightly stretched out normal, right? Which is...
Nothing goes back the way it's supposed to.
Gosh dang it. Right? I know.
All the way down to the veins.
Yeah, that's it. All the way down to the veins. And then the next time you put it under pressure, it just stretches that much more easily. So
let's talk about, okay, it's common. There's so many things that cause it. You know, what's the good news here? Because I think that's the thing, is how far we've come.
Yeah, the really good news is the treatments are I always tell folks, you know, we do have to do some things to you. We do have to poke you with needles, right? But no cuts, no downtime. The treatments these days are very tolerable. They're very good. They work well. So if you did get that bad dose of vein disease genes from your folks, the treatments aren't terrible. They're definitely, you know, worse diseases that you might have gotten. So that's the good news.
Yeah.
And what are the exact treatments? Can you do it with lasers? A little bit of needles, you said?
Yeah. The two basic treatments that we use these days, one is lasers, and there are two kinds of lasers. So for some veins, you shoot a laser through the skin down into the vein, and then for others, you actually put the laser inside the vein. It's kind of weird. People are always a little uncomfortable with that concept, but it sounds much weirder than it actually is.
Okay.
And then for the rest of the veins, you can usually inject them with a medication that makes them go away. So again, no cuts. There's no pulling anymore. It's a pretty tolerable batch of things.
What about insurance? Does it often cover it?
Most insurers will have policies written about it, and it depends on size, shape, location, symptoms. So there's some variables in there, but most insurers will have coverage for certain levels of vein disease, yes.
And you're doing free consultations till the end of the year.
We are, absolutely. And that's one of the, again, one of the roadblocks that people run into is a lot of people think, oh, this is just a cosmetic issue.
Yeah.
Oh, I don't, you know, there's no insurance coverage. oh, they've had a friend who had stripping and they're really worried about it's going to be miserably painful. And so to try to remove that barrier, we thought it would be a good idea to offer free consultations. That way you can come in and have things looked at and figure out where you are.
And just know what's going on.
Absolutely.
Well, here's the information, because those free consultations, again, are through the end of the year at the Brookfield Clinic. So through the end of the year, you've got to call to make an appointment at 866-618-VEIN, or you can visit online at veinclinics.com for more information or to schedule your appointment there as well. Thanks so much,
listen
Doctor.
to your legs.
Yeah.
Listen to your legs.
I like
That's
that.
right.
Good stuff. Thank you so much, Doctor.
Thank you.